Can AI replace registered nurses? AI is revolutionizing healthcare, assisting nurses with tasks such as clinical decision-making, predictive analytics, and patient monitoring. However, despite its growing role, AI cannot replace the human qualities that make registered nurses, RNs, irreplaceable in patient care. Key qualities of nurses AI can't replace. Emotional intelligence and compassion. Nurses provide comfort and emotional support, which AI lacks. Studies show that emotional connections with nurses improve patient outcomes and recovery. Ethical decision-making. Nurses make complex ethical decisions daily, ensuring patient rights are prioritized. AI cannot navigate the moral and cultural complexities involved in healthcare. Adaptability and critical thinking. Nursing often involves unpredictable situations, requiring quick thinking and judgment. AI can't match a nurse's ability to adapt to changing patient conditions. Collaboration and communication. Nurses are central to teamwork, coordinating care between medical professionals and families. AI can't replicate the interpersonal skills needed for effective communication and conflict resolution. Conclusion: AI is a valuable tool that enhances nursing practice, but it cannot replace the critical human elements of empathy, ethical judgment, and adaptability that define the nursing profession.